Holistic Hub. I am your host, Dr. Shreyas. Today we have a special guest, Dr. Hemant Bhargav. So let me give a brief introduction of Hemant sir. So Dr. Hemant sir is currently working as Associate Professor of Department of Integrative Medicine in NIMHANS, Bangalore. He is also working as a visiting Associate Professor at Harvard, USA. He is a DBT Wellcome Trust India Alliance CPH Early Career Fellow. He has published more than 100 research papers in Indian journals and around the world. He has finished his M.B.B.S from Indira Gandhi Government Medical College, Nagpur, Maharashtra. Diploma in Community Mental Health from NIMHANS. And he has done MD and PhD in Yoga from Svyasa Bangalore. So, welcome sir. It is a pleasure having you here.
Same here.
So, let me begin with a very interesting question. How did you come from allopathy background into integrative medicine and yoga field?
Thank you, Shreyas. This is a question which many people have asked me even before. I still remember my internship days, when I was in IGMC Nagpur. During internship, I used to see that our medicine OPDs, were quite heavy. In 3-4 hours, we used to see 100-120 patients. And as an intern, the consultant would sit in front of me and I would sit on the other side. And there would be huge queue of the patients. And we would barely have 30 seconds to see the patient. But as an intern, my only work was to write CT all or continue same, because most of these patients were patients suffering from diabetes, hypertension, and they used to come to government hospital to take the medicine for free. During those times, I used to think, whether there is any way that is, possible that these people, these kind of illnesses which have become the major killers, whether people could be cured. In modern medicine for these lifestyle disorders, we use control. We never use the word cure. So in search of that cure, I started exploring, and I, had some anecdotal experiences with patients who had explored the traditional wisdom and showed very good responses in these conditions. So I, developed interest towards the traditional systems. Because they have survived for thousands of years, there must be something. Definitely things should be scientific and we should test it out using the scientific methodology. But I always believed that there is some wealth of knowledge through which the modern medical system can be enriched. And the lifestyle of these kind of patients can be really enhanced, and we definitely can contribute in this area. So that was the reason that I decided that I will, explore this scientifically with a scientific bent of mind and find out whatever that is best in the traditional systems of medicine and integrate it with the current knowledge of modern medicine to give the best to my patient. So that is what motivated me towards this line.
Quite interesting. And it has been a great journey till now. So, I would like to ask you about some basic questions that the viewer might not be aware about. So, what is integrative medicine?
Yes. Integrative medicine, is not a new concept. In India only it has come up as a new concept. But you see in US, Germany, Australia, integration or integrative medicine centers have been working for more than 2 decades now. So integration is, a very humble approach. This approach believes that no single system of medicine can answer all the questions. So therefore, we should be humble enough to learn from different knowledge systems, different systems of medicine that are available, and whatever that is best in each of them, synergistically, can we use them together with a single objective of giving the best possible clinical care to enhance quality of life of the patients.
Definitely. So, what you mean to say is every system has advantages as well as limitations.
Yes.
And when people from different disciplines come together with a better goal of treating patient, then we can get maximum results compared to any one system.
Yes, and we see that in India, people actually expose themselves to multiple systems already. They may be hiding this from the doctor, but any patient who comes to modern medicine doctor definitely would have tried some homeopathy, he would have tried some Ayurveda or some yoga or such kind of treatments. So patients do not tell this to doctors, and then that is more harmful. Better approach is that the doctors also open up about it, patients also open up about it, and then whatever in patient's experience has helped him, doctor can interact with the treating physician of the other discipline of medicine, and mutually they can learn from each other, be open about the science, and this way the whole medical system of the country also can grow better towards one nation one health policy. We see that China has been doing it. Traditional Chinese medicine is recognized worldwide, whereas our traditional system of Ayurveda does not have that kind of a recognition, or the systems of medicine that are indigenous to our culture. The reason is that in China, the traditional Chinese medicine, they have respected their own tradition, and people who practice modern medicine, they also learn the traditional Chinese medicine. And in fact, the TCM is the first system of medicine where patients are exposed to, and then when they don't improve, then they go to the modern system there. So this aggressive approach of China, where they did lot of research with TCM, and the modern medicine people in China actually took up TCM as a PG subject and did lot of scientific research and found out what are the areas where this can be integrated. As a modern medicine physician, we all know that there are a large group of patients who come to us with non-specific complaints. We cannot put them under any specific category also. Bloating of the abdomen, indigestion, or there are non-specific low back pains and such kind of conditions where we see that even the modern medicines or the conventional approaches do not work. All this group of patients, definitely in my own clinical experiences can be helped a lot. The illness also can be understood from the Pancha Prana, Pancha Vayu, Vata, Pitta, Kapha kind of a model. And in prevention, in management of these non-specific or resistant cases where modern medicine, has its own limitation, these systems of medicine can enrich our, clinical knowledge and clinical care.
Yes, yes. So, what are misconceptions among people about integrative medicine?
Yeah. So one major misconception, is that, that one particular system, has all the answers. People follow all or none approach. They say, okay, I tried modern medicine, it didn't work. Now I completely leave modern medicine, and now I will do completely only Ayurveda. Or I tried Ayurveda, it didn't work. Now I will completely try homeopathy. So this is a misconception that a single system of medicine has all the answers. So in my clinical experience of a doctor who has exposed himself to different systems of medicine, I find that every system has its own strengths. There are certain conditions where certain systems work very well. For example, in emergencies, there is no other kind of a thought that modern medicine is the answer. It is life saving. You cannot ignore that. The ICU care that is offered, road traffic accidents, the emergency situations where critical care is given to patients, there is no parallel to emergency medicine. It has to be there. Similarly, we see that modern medicine, brought in a new revolution into medicine when the infectious diseases were understood and then antibiotics were developed. Cholera, typhoid, plague, malaria, these were major killers. Tuberculosis. Modern medicine has won over it through lot of research and painstaking kind of an effort that has gone for decades together. So these are laurels, So these are the strengths of modern medicine. In the same way, modern medicine has been able to control dreaded disorders, which we did not even know. People were dying, but we did not know that they were dying because of diabetes or because of hypertension. Now we know that and we can prevent that. This is all because of modern medicine. Even in the field of psychiatry, the only treatment available for severely mentally ill patient was to put them in the asylums. It is the gift of modern medicine that now severely mentally ill also can remain in society. They can be integrated in the social system. So modern medicine has offered us several wonderful boons, but then thinking that modern medicine has all the answers to all the questions is also not correct. Especially being a M.B.B.S doctor, I know that we are not taught much about the dietary aspect, but Ayurveda has lot of wealth of knowledge about what are the pathyas, what are the apathyas. The personalized approach of Ayurveda is so beautiful, where you give them the lifestyle according to their prakriti, also according to different ritus, different seasons, and also the daily rhythms. It's a very beautiful kind of a dincharya, ritucharya, pathya, apatya lifestyle concepts. Now this can very beautifully be integrated into modern medicine, because a modern medicine doctor doesn't have much to tell. In fact, when I was medical officer in villages and I was prescribing them, antidiarrheals and all those medicines, patients would ask, "Doctor, please tell me pathya, apatya." So I didn't know, but these villagers were asking this about me. So it would be nice, if we could enrich the modern people about these aspects of lifestyle that are there, and also enrich the traditional medicine people about, the wonderful diagnostic methodologies, as well as, tell them when to refer which kind of patient if there is an impending emergency. So in this way, I believe that systems should come together. There should be an openness. There should be a dialogue. Because one common thing between a practitioner of traditional system of medicine or a modern system of medicine is that both of them care about their patient and they want their well-being. And patients are anyway exposing themselves to different systems. So if we talk to each other, we learn from each other, I believe that we will have better patient satisfaction, and in this way the learning also will be better and clinical outcomes also will be better. This is our clinical experience in the Department of Integrative Medicine at NIMHANS.
Yes. So what you are saying is, anyway, patients are going to different systems. So if we have an integrated setup in government or in private, doctors can collaborate with each other and have a patient-centric approach where patient is at center, and doctor from allopathy, Ayurveda, yoga therapist, psychologist, nutritionist, all are coming together and creating an individualized treatment program for that patient.
Yes. I prefer the term modern medicine over allopathy.
Yes. Definitely. And we have to understand that each pathy has its role. So as you said that modern medicine has more of role in emergency conditions. Nutrition can be dealt with Ayurvedic principles. So each pathy has its role, and
yoga has wonderful, physical activity. Then the role of breathing, in the autonomic nervous system modulation. ANS is playing greater and greater role in chronic NCDs. So there the pranayama techniques are very wonderful, and the meditative techniques of yoga for the calmness of the mind. Similarly, in my clinical experience, I have also seen that homeopathy, especially in children, the vital power that they say in homeopathy, it is quite responsive in children. There are certain very good medicines. They are cheap also. It is quite cost effective also, and conditions related to skin and conditions related to allergy. These conditions I have seen homeopathy doing quite well. Of course, you have to be careful. There should be a proper, genuine homeopathy practitioner who has done his thorough clinical practice into it for years together. You have to go to a very quality doctor in homeopathy, because homeopathy treatments are decided on the basis of a detailed history and the psyche of the patient. You cannot prescribe homeopathy in the modern medicine way, just like one medicine for everybody. So this also I have seen. If the doctor is not good, it doesn't work. And sometimes, some doctors are there, who do not have that kind of a intelligence or the kind of a understanding of their system of medicine, and then they start mixing steroids into their medicine and practice. So I do not propagate that kind of a practice, but in my experience, there are quality homeopaths who, have shown miraculous results. Yes. But it depends on the quality of skill and learning of the practitioner also.
Yes, definitely, definitely. So, I would like to ask you regarding the role of yoga therapy in different health conditions as a monotherapy, as an add-on therapy, and especially about psychiatric illnesses that you specialize in.
Yes. So yoga, if you see, traditionally is a spiritual discipline. It developed to enhance the spiritual evolution, to accelerate that. Swami Vivekananda said that what you are going to achieve, in 10 years, certain yogic techniques in terms of evolution of your mental strength, resilience, there are certain yoga techniques which can give that to you in 1 year. So to accelerate the human evolution, this science was developed. The origin of yoga goes back to Shiva. Shiva taught it to Saptarishis. And from the Saptarishis, this wealth of knowledge spread across and came to us. Now, these are the tools and technologies for inner well-being. The way science has progressed, science has looked into developing the aspects of technology and science related to the 5 basic elements outside. We have developed rockets, we have gone to moon, skyscrapers, we have made tunnels under the sea. So we have conquered all the 5 basic elements outside using external science and technology. Now, these 5 basic elements, air, water, earth, fire, space, are there in this body also. They are there in the subtle form as the pancha pranas or 5 energies, and in the subtlest form they are there in the form of thoughts in the mind. So there are thoughts of dullness, there are thoughts of overactivity, there are thoughts of aggression. They all represent these 5 basic elements in their subtler aspects. So yoga is the science and technology of developing mastery over these pancha mahabhutas at the level of the body, at the level of the energy, and at the level of the mind, so that you develop a harmonious, rhythmic kind of a atmosphere within you and feel blissful and energetic within you. So outside we have mastered, but the inner well-being, has been forgotten, which our ancient sages remembered. So this is why this science was developed. Now, one aspect of this mastery over the Pancha Mahabhutas within me, within my mind, is that in diseases also these 5 basic elements, their harmony is lost. So Ayurveda says that Vata is a combination of air plus space. Pitta is a combination of water plus fire. Kapha is a combination of water plus earth. So these 3 basic humors form the basis of Ayurveda. Very interestingly, Hippocrates, who is the father of modern medicine, also started with 3 humor based concept only. So black bile, yellow bile, and those concepts, they correlate with these aspects of Ayurveda. So then you see that these doshas either can be modified by taking herbs, they can be modified by taking modern medicine also. They are also, in a way, nothing is beyond these 5 basic elements. So yoga is an aspect of therapy where I use my own body, my own breath, my own mind to manage the synergy of these 5 basic elements, these 3 doshas within me. So this is how yoga therapy has evolved, especially in the last 2 decades, in the new millennia. There have been renaissance of this age-old science, especially its therapeutic aspects. Now if you go to PubMed and put the word yoga, you get more than 7,500 hits where yoga has been used in systematic randomized controlled trials. So it shows that the inner well-being plays such an important role in managing these kind of, especially the lifestyle related disorders. So if you see the literature, there are more than 30 randomized controlled trials on diabetes. which consistently show that adding yoga into the lifestyle is useful. With 6 months of regular yoga practice, you can improve your HbA1c 1% over and above what you gain by adding the oral hypoglycemic agents and insulin. Similarly, there are more than 40 trials using yoga and or meditation in hypertension. The first RCT itself was comparing meditation with biofeedback, and it is a technique through which, using the power of the mind, the blood pressure can be controlled or prevented. We see that enough evidence is there where yoga is useful in managing chronic low back pain. In Harvard, I think the textbook of medicine, we also see that it is recommended for back pain, fibromyalgia. Cardiac rehabilitation is another area where yoga has been found very useful. If you come to the domain of psychiatry, then the strongest evidence for the clinical utility of yoga is in depression. Initial trials used yoga as an add-on, but recently there have been trials, 2 trials from actually United States. Sudha Pratikanti et al. Did it in 2021, and then Nair et al. Also did another trial in 2018. There was one trial in AIIMS, New Delhi also, where in NIMHANS also there are a couple of trials where we have used yoga as monotherapy in mild to moderate cases of depression. When you start feeling depressed, when you start feeling low, when you do not find any interest in the activities that you previously used to enjoy. These are early signs of depression. You get loss of appetite, early morning awakening. That phase, if you do not want to try antidepressant and want to use yoga as a first line therapy, it is very much welcome, scientifically proven. Only if the patients who have severe depression, when there are active suicidal ideations, then it is recommended that you take the help of psychiatrist, take antidepressant and start yoga simultaneously. And you can. So another thing, very interesting thing is people who come to us, even when we discuss with psychiatrists also, we know when to start antidepressant, but it is very difficult to answer when to stop antidepressant. Once it is started, it is very difficult to reduce it. Our clinical experience has been, even people who have severe depression, if they take medicine, they develop better capacity to do yoga. Once they start doing yoga in its proper quality, after a 6 weeks or so, the medicine show their effect. Then if they continue doing yoga regularly for 6 months, then we observe that definitely their medicines can be cut down. And in another 6 months, they can further be reduced and stopped also. We have, a data of more than 30 patients like that, where we have been able to completely stop their antidepressant with regular yoga practice of 6 months. By regular practice of yoga, I mean at least 3 sessions a week. To have sustained effect of yoga. That is the dose that we have observed, and there are trials showing the effect on the increasing the GABAergic tone in the brain, the calming effect of yoga. To have sustained effect, minimum 1 session should be done per week. If you see the Western studies on yoga, they are all weekend yogas, 90 minutes of yoga per week or something like that. But in the Eastern setup, we see that yoga, people want to do it like regularly, 5 days a week kind of a model. Our experience is, the higher the dose of yoga, the quicker the effects. In fact, we have observed that the antidepressant takes 6 weeks to produce their effect, but the yoga effects start coming even within 2 weeks if people come every day. So the effect of yoga are faster in depression than antidepressant. This is my clinical experience.
Really interesting.
Yeah. And we also see that if they follow this model of doing yoga, then their requirement for antidepressant comes down. Definitely this should not be done by the patient themselves. They should always consult a psychiatrist, and the psychiatrist should evaluate their symptoms, see if the scores are coming down, then reduce the medicine. And patient should be patient enough to practice yoga for a year, before they want to take any abrupt decision, or to want to reduce their medicine. But we have a 2-year follow-up data of these patients also, where they have not relapsed. So with recurrent depressive disorder, you see that significant number of people who stop antidepressant, do not comply with medicine, they relapse within next year. But these people who continued practicing yoga, made yoga as a part of their lifestyle, we followed them up But for a year they did, and after that we did not tell them to continue. But we observed that people then found that it was a good addiction. Yoga is a good addiction. Once you do it for a year, you want to do it every day. You want to start your day like that. So we run some teleyoga sessions in the morning where these people join, and they say, sir, yes, I just wanted to continue doing it. Even people who left it, they also did not relapse in the next 2 years, whereas people who are continuing it, definitely they are not relapsing. So depression is one area. Second area in mental health is schizophrenia. This is very interesting. When in the beginning, when we were thinking of doing research in this direction, people were laughing at us. Schizophrenia, the person is not in touch with reality. He's not in his senses. What yoga are you going to teach him? But in schizophrenia, what we observed was that this illness has two aspects to it. One is the loss of touch with reality and the positive symptoms of schizophrenia, where it becomes difficult for the patient to remain in society, where they have aggressive kind of approach, they have those delusions, fearfulness, and inability to interact with people. And the things that if they do in society, it creates trouble for themselves and others. Those kind of patients find it difficult to do yoga right from the beginning. But modern medicine, the antipsychotics are quite effective. So within 2 weeks, these symptoms go down. But the major problem in schizophrenia is the negative symptoms, where the ability of the patient to express his emotions go down, his cognitive abilities of, thinking, analyzing, socially interacting, connecting with other people goes down. So people find that, okay, the person's aggressiveness has reduced, but he's not the same person as before. He is not able to empathetically or emotionally connect with people around. With yoga, we have observed patients, especially caregivers, who come to us and tell that modern medicine, helped him calm down, but yoga gave me my son or my daughter back. I remember a case where a son who had schizophrenia bought a sari, for his mother on her birthday, and he said to his mother that, I want to thank you for whatever you did for me for so many years, and orange is your favorite color, so I got a orange sari. There were tears in the eyes of the mother, and this was the person who had done more than 100 sessions of yoga with us. So something in schizophrenia, is not able to express that empathy, that emotional expression, that understanding and connect. That comes back with yoga. So modern medicine has its strength in blocking, receptors which are aggressive. And yoga and Ayurveda, naturally, these systems of medicine open up. They open your shrotas, your channels which are blocked. So somewhere blocking is needed, somewhere opening is needed. When only modern medicine is used, it blocks everything. So in these conditions, I think yoga is a very beautiful adjunct in schizophrenia. And we observed that these were the most sincere patients who, once allotted to a yoga batch, would regularly come. They become childlike. So yoga came up as a very, very effective. Patient showed very good compliance, and we could perform actually 3 randomized controlled trials, outpatients. Dr. Shivrama Varampalli has done path-breaking work, in this area. He's a professor of psychiatry in the Department of Psychiatry here. So we have done now follow-up of these patients also for a longer time and see that the negative symptoms come down significantly. Third area is substance use disorders, where as an add-on, it has been found that people who adhere to yoga practices, they are able to manage their stress better. Stress is a major contributor, the allostatic load that contributes to relapse, ability to maintain abstinence goes down. So if yoga as a stress buster comes into the system, then definitely their ability to maintain that abstinence, prevent that relapse becomes better. We have done some trial even in people who are addicted to heroin and opioids also, where we are finding encouraging results. And then somatoform pain, chronic pain conditions, there also yoga reduces chronic pains. Probably pranayama increases oxygenation into the muscles, Mentally also they feel relaxed, fatigue comes down. Also in elderly population, where they show early signs of cognitive impairment, dementias. There also we have found that 6 months of regular practice of yoga in old age homes, naturally the brain shrinks with age. But we found that in this elderly population, by doing yoga regularly for 6 months, not only did the natural shrinking of the brain stop, but actually the hippocampus area of the brain increased in volume. So it means that indirectly, yoga as a lifestyle can have a protective effect against Alzheimer's, regular practice of yoga. So these are the areas where we have been doing research, and in psychiatry where yoga is useful.
That is really interesting. So, can you tell more about the neuroplasticity aspect, like you explained regarding the hippocampus?
Yes. So very good question. Neuroplasticity, it is the ability of your brain cells to form new synaptic connections in response to any kind of an insult, trauma, or vascular causes are there. So if the brain suffers from any kind of such kind of a problem, how quickly is the brain able to recover? Earlier understanding in neuroscience was that different areas of the brain are responsible for different kind of functions. But the more and more that we understand in neuroscience, we are now able to understand that rather than a particular area of the brain, it is the particular circuit, that determines particular functions. So there are different circuits in the brain that monitor or moderate different kind of functions of the brain. Now these circuits and their efficiency, depends on the synaptic connections. So Hebb's law says that neurons that fire together, they wire together. So the more you use a particular circuit of the brain, the more stronger it becomes, and there is a natural ability in the brain to take up the function of the other brain area which has been damaged. So this is known as neuroplasticity. One of the marker of neuroplasticity is a chemical known as brain derived neurotrophic factor, BDNF. So we have observed that in chronic neurological conditions like schizophrenia, depression, this BDNF goes down. It means the ability of the brain to respond to stressors, and form new connections and take over the function of other areas of the brain reduces. So with yoga, in both these conditions, we have published papers where we observed that the BDNF levels increased in as less a duration as 12 weeks of practice. So minimum 3 sessions per week for 12 weeks, they start enhancing your BDNF. And if BDNF goes up, if brain forms new synaptic connections, the gray matter area in the brain increases. One meta-analysis of more than 30 neuroimaging studies of yoga concluded that regular yoga practitioners have thicker gray matter in the prefrontal cortex, in insula, in hippocampus. So these are the areas which are related to memory formation, and the response inhibition, impulsivity, and those executive function and cognition areas. Insula is related to interoceptive awareness, my own awareness of my own bodily, sensations. So all these things are improving with yoga. And regular practitioners, as compared to those who have never done yoga, they had a shrinkage of the brain. Whereas the Lazar et al. Famous study, where they did a cross-sectional trial of their brain thickness and age, and found that people who never did yoga had a steeper slope of shrinking of the brain gray matter, whereas people who did yoga, the slope was less steeper. So it had an indirect protective effect.
Interesting. As it can help you form new connections, will yoga also help in removing unwanted or unhelpful connections?
So this is something, which we call as the pruning, pruning function that takes place in the brain when the brain is developing. The unwanted connections, the unwanted neurons are pruned, which we do not use. and then the active, whatever is more useful for the efficiency of the person, or whatever that he is using grows. Whatever that you don't use, slowly those connections are lost. So as I said, neurons that fire together, they wire together. So yoga is one such technique where the person develops the ability of bringing a smooth shift from one set of networks into another set of networks very quickly, and smoothly, without wasting any energy or efficiency in that. Say for example, in a resting brain, when I am resting and thinking, there is a default mode, resting brain network, that functions, where when I do a task, this network is inhibited and task network comes up. When these two networks are confused, when I think about something and I am reminded, or the task network comes in, or when I am doing a certain task and the resting network comes in, then my efficiency reduces. So with yoga, studies have shown that the coherence within the DMN improves, and the coherence of shift from DMN, default mode, to task mode to default mode also becomes more efficient and more smooth. So this is the way yoga enhances the plasticity in this shift. So one application of this aspect that we can see, especially in the younger generation here, is that we see a lot of adolescents who come with difficulties in managing their emotions. They are intellectually very sharp. In the current education system, it emphasizes on the sharpness of the intellect. So intellect is very strong. If you want to debate with them, you take any topic, they will tear it apart. They go to very depth of it and they prove their point. Very difficult to debate with today's adolescents. But when it comes to the emotional aspect of their life, they are stuck. If there is a breakup in relationship, they just simply do not know how to come out of it. And the habit that they have developed is using intellect for everything. Intellect is good when you want to do a scientific research or certain scientific aspects of your life, but you cannot apply it everywhere in your life. You cannot apply it in your relationships. You have to be non-judgmental there. There are different kind of people, So searching for a perfect partner, having a lot of perfection in your, being very choosy, being very judgmental. When you use that cutting, ability of the intellect in the aspects of life where you should have used emotions, then you fail in relationship. So it is here that the aspect of yoga come in, where you develop the ability of letting go. So I call it Abhimanyu syndrome. Abhimanyu was an adolescent who knew how to go into the Chakravyuh, but he did not know how to come out. Our adolescents are also like that. They know how to go into the very depth of an issue, but when they are emotionally stuck, they are stuck. They just don't know how to come out of it. So yoga is the holistic development of the brain, the left brain, which is more intellectual, right brain, which is more art and emotion. Studies show that yoga enhances the balance between the right and the left. In yoga philosophy, the right nostril is called as the sun channel, which is more intellect based, more knowledge based. The left is called as moon, which is more artistic. And when you do Nadi Shuddhi Pranayama, you are balancing the right and the left. So the balance is very important in life. Whenever you skew down to one side, then you start developing problem. In fact, all the psychiatric illnesses, you see, they are the skewness. Either a person has become too hyperactive or he has become too dull. This too much hyperactivity is called as rajas, the sun overactivity. Too much dullness, withdrawal, not doing one's own duties, that is called as tamas, or too much coolness, it is the moon. So in modern psychiatry, currently what is going on is that when person goes to the extreme of hyperactivity, they give him medicine for him to come to the coolness. Then he gets too low. Then you increase him, and then the chances are their patient goes to the other side. So the whole approach is activating the one which is down and deactivating one which is up. But yogic approach is transcendental. You first come to the middle path, develop a balance, and transcend both. This is the new wave psychotherapy, the mindfulness based psychotherapy, the metacognitive psychotherapy have all come from these spiritual aspects of yoga only. Thousands of years ago, in Bhagavad Gita, there have been description of meditating like that, going beyond the gunas of tamas and rajas. Similarly, these concepts also were again emphasized by Patanjali. They were again emphasized by Gautama the Buddha also. So this is why, yogic approach is beyond dualities, beyond the polarities. There is a third dimension that the human mind has to reach. And it is here that lies lasting mental stability. So this is the aspect that we add here.
That is quite interesting, sir. So, like as you said, today's youth especially are very, cognitively sharp, but at the same time their emotional development is stunted. Like it is like a person is going to gym but doing only biceps, but rest of the body is thin and only few muscles like ekangi growth. And what you are saying is it is a holistic growth of an individual, sarvangin growth. Yes.
I completely agree with you.
Yes. So, I would like to ask you regarding certificate course in integrative medicine. So that was the course through which we met, and I also, after completing my M.B.B.S, decided to go on the same journey, thanks to you. So how did this idea come up, and how has been your experience till now?
Yes. So as I told you, that I always believed that every system of medicine has its own strengths and weaknesses, and there is, there should be this humbleness. Nobody has all the answers. So we should be humble and we should try to learn. Always, person should be a student. So the whole philosophy behind this course is that can doctors of different systems of medicine come together on a single platform, take up a challenge, take up a problem, take up a disease condition, and then we explore all the possible approaches that are there. So we take up depression. Depression, first the modern understanding. This is the modern therapy. These are the percentage of people who respond. These are the people who do not respond. These are the challenges. Then a Ayurvedic, expert comes from Manas Roga. He shares his views, his treatment methodologies, his strengths, his weaknesses. Then comes a homeopath. He provides his own perspective of understanding, his own clinical experience. Then comes a yoga therapist who talks about his own understandings. We also have a Sova Rigpa person. We also have a Siddha expert, a Unani expert. So all major systems of medicine that are there, we hear from all the experts together, and then we bring them onto a single platform. And after that, the students like you, like me, like students all that are there, they ask their questions, and then we learn, okay, at which phase of depression, what kind of, so in the beginning, if people come with mild to moderate depression, coming to a consensus together, what can they do? If they are willing, okay, yoga can be the first thing that can come. If the person is not in a state of doing yoga, what is the next safest approach, which has least side effects, and if patient doesn't respond to that, what is next, and then if you have started modern medicine there, so how long would you want to do it? Along with it, what can go safely with it? What is the current evidence that is there? How much work has happened in this area? What is to be done in future? What kind of researches can be done by the students who are enrolled with us in their own MD thesis? So taking the science further. First, this is a platform where we are just orienting people, exposing themselves to different worldviews, and then igniting that interest towards a science which is in its earlier stages of development. Definitely a lot of work has to happen, and but it is very important to start it somewhere. So with this approach, this course has been started by NIMHANS. Already 2 batches have passed out. Around 50 doctors have passed out, and I'm very happy to know that a lot of M.B.B.S doctors have enrolled like you, and their feedback has been that it was a very enriching kind of experience. They did not know the different systems of medicine and what do they do. Ultimately, I say that even if you want to deny something, you have to first know what it is, experience it. So you say that, okay, Ayurveda, yoga doesn't work. To say that also, you have to do a trial, show that it didn't work, and then say that it doesn't work. If you are saying that it doesn't work without doing a trial, then you are also being non-scientific. So even to deny, you require science. So we are talking what we have done, what we have experienced, and I want this science to develop based on data. I do not want it to develop based on anybody's subjective feelings, whims, or fancies. Otherwise, this science will collapse. So the whole approach is a strict scientific approach, case-based approach, and taking the science further.
Yes. So what you are saying is, even if we have, as a doctor, we have subjective interpretation, understanding, as well as our own views on any pathy or any system or any practice, it is necessary to first do a clinical research on it, first do a randomized control trial, pilot RCT, like in some form, or case study, and then find data, does it support our hypothesis or not, and then come to a conclusion. And that is something that we really need today, because when I go on YouTube and see people, they will say, do this asana and your asthma will go away, do this asana and this will go away. So this is distributing misinformation among people.
This is a major problem, major problem. I request your viewers to be wary of such people, who tell you that this will completely cure your problem. Never go to such people. Human system is very complex. Things are not as simple as doing such a small thing will just cure it. Life is a continuous struggle. So therefore, you have to adopt an approach where you want to bring a lasting transformation and change in your lifestyle. A quick fix, is never a solution. Everything stems from a deeper imbalance. So therefore, it is always a dynamic process. It is never a fixed, static kind of a process. The health is a continuum. You grow from illness towards health, from health to perfect health. You keep moving forward. So yoga therapy is best as a lifestyle. It should not be prescribed like modern medicine. This asana will cure this. This kind of a approach, in my own experience of more than a decade in this field, doesn't work. And anybody speaking to you in these terms, you should be wary of such a person. You should be careful.
Definitely. So when we are discussing topic of research, currently you are doing your research at Harvard, and you were also invited to teach and speak in Brazil, in Germany, in USA. So how was your experience there, and how those people are perceiving yoga as well as our own traditional systems?
Oh, very interesting question. See, the Western understanding of yoga is very different from the traditional Eastern understanding. For them, yoga is another workout. And even the awareness that yoga can be a therapy for conditions also is not there. Even when they see yoga as a workout, this is all related to the muscle alignment, bone alignment, and the biomechanics of yoga. They are more interested in that. Their yoga practices also are quite slow. They do it with a lot of perfection, and they take longer time to learn and master a particular posture. They also, but it is good also, they follow the principle of non-violence, to the core, and avoid anything in yoga that can harm them. So that way, this is something that we can learn from the West. The biomechanics aspect, what should be the alignment of the body, the center of gravity, the weight transfer on different bones and muscles of the body while doing different yoga postures. But at the same time, I think they are missing a lot, especially When you look at the understanding of yoga given by sage Patanjali, where he had 8 limbs of yoga, no, yama, niyamas are the fundamentals of yogic lifestyle. Then the third limb is asana, the posture. But after that, there is pranayama, the breath, which is, its own domain, the energy, sense organ control, which is the need of the hour, which is pratyahara, turning inwards. And then the higher dimensions of meditation, dharana, dhyana, samadhi. So these are not, very much, explored. But here in India, even at NIMHANS, the model that we follow is an integrated approach of yoga, where we use all the limbs that have been prescribed by Patanjali. And very recently, we have been coming up with the philosophy of yoga also as an Indian model of psychotherapy, especially in managing stress, in managing depression, anxiety, grief. And we are getting some very interesting, initial results. So this is the difference.
Yes. Yes. So what you're saying is they are more or less focused on asana aspect of yoga. That also they have tried to perfect it through biomechanics, and they follow non-violence, ahimsa, with themselves. At the same time, there are 7 more tools that are available in the yogic inventory according to Sage Patanjali, which are practiced here in our own Bangalore in NIMHANS.
Yes, in many centers in India, other centers also are doing that.
Yes.
But I believe that slowly, as the correct understanding of yoga grows, yogic understanding will grow in 2 directions. One is that other limbs of yoga given by Patanjali will be integrated, and the philosophy of yoga in 4 streams, the yoga of willpower, Raj Yoga, the yoga of intellect, Jnana Yoga, yoga of action, Karma Yoga, and yoga of emotion culturing, Bhakti Yoga. These 4 streams also will grow simultaneously, and that is the way I see that this science is progressing and should progress.
Yes. And even if we look at Western models of psychotherapy, they also have therapies like CBT, where there is thought, there is emotion, and there is behavior. We have Raj Yoga as an additional tool. So, anyhow, our basic fundamental understanding of human being as a whole was very much advanced compared to how we perceived it. So now, as more and more research is being done, like in flow state, which is like Karma Yoga. So Karma Yoga, as we go into Karma Yoga, we go into a flow state. We are not concerned with the outcomes, and we are able to achieve better results with our action, and still we are not attached to it. So there are more venues to do research, as you said. Right?
Yes, in fact, the more I read modern, psychology, I see that we are just rediscovering the science in a newer language, what has been given thousands of years ago in Indian scriptures. For example, if you look at the aspects of, as you were saying, CBT, we see that the Krishna-Arjuna dialogues that have happened in Bhagavad Gita, there are a lot of component of cognitive restructuring that Krishna does to Arjuna. So CBT component is there. We see that in the samatvam aspect of yoga, bringing a balance, approach which, Gautama the Buddha also proclaimed. We see that the DBT component comes in. In Bhakti Yoga, we see the REBT, coming up there. Similarly, the flow state by Mihai Csikszentmihalyi and Karma Yoga. So this way we see that the concepts were there, and now it is very good that positive psychology, is coming up and taking these value systems and in an evidence-based way and rediscovering the old science. So this is very exciting area where yoga and positive psychology will meet each other in future. So I am very excited about it.
So integration of Western psychology and our own tools.
Yes.
That is something really exciting. Yes. So, what is the government's approach towards this right now, and how they are expanding this in government setups throughout India?
Yes. So I see that especially in the last decade, there has been lot of support from the policymakers, especially if you look at the NIMHANS model. The journey at NIMHANS started 15 years ago, where there was a research project funded yoga center through which 1 or 2 patients were coming. But then later this yoga center was taken within NIMHANS. It became a part of NIMHANS. It was functioning under the Department of Psychiatry as a center. In 2019, the center became a separate department, and Ayurveda component was added into it, and it became a department of Integrative Medicine. So this was an initiative taken by Ministry of Health and Family Welfare. This is one of the first such kind of an initiative in a tertiary care government kind of a hospital and medical college. This also was a pilot by the government. There are faculties from the discipline of yoga, from the discipline of Ayurveda, from the discipline of psychiatry, modern medicine, and all of them are receiving same pay scale. There are junior residents, senior residents of modern medicine, of traditional medicine, yoga, Ayurveda, psychiatry. They also receive the same pay scale. So for the first time, the traditional system has been respected. And unless you and me are at the same level, there cannot be open dialogue. There cannot be a mutual learning. And very interestingly, in our OPD, all 3 consultants, the modern medicine consultant, yoga consultant, and Ayurveda consultant, we all sit together. And, the senior resident, junior residents of respective discipline, they take the case, and all those 3 residents come to us, present the case, all 3 discuss with each other, and give the holistic input to the patient, deciding the proper path. Not that all the therapy should be given together at one point of time. This is not a khichdi. Very systematically based on, and also involving patient in the decision making. So deciding what is to be done in the first phase, what is to be done in the next phase, what is to be done in the third phase. Mutually agreeing with each other, we make a treatment plan, and we find that it has brought a lot of patient satisfaction. 90% of the patients who come to us are self-referral, and exponential rise in our OPD and IPD admissions in the last 2 years. Patients feel especially happy because they are involved in decision making, and it also saves their time. Going to 3 different consultants on 3 different days, taking their advices. And when these consultants don't interact with each other, sometimes their advices are countering each other. So patients get confused. So here we learn from each other, patients' doubt gets solved, and the residents who are listening to us, they are developing into an integrative physician. So this is the NIMHANS model of integration. Now seeing the success of the NIMHANS model, government has taken this initiative of starting this kind of department of integrative medicine in all the AIIMS. And several private medical colleges have already come up with such a model. For example, SGUHA in Kolar is already having it. In Mysore Medical College, there is already a department of yoga. In Pune, in a private medical college, the Department of Integrative Medicine has come up. We see that in Bangalore Medical College also there is a Department of Integrative Medicine. So these departments of yoga, departments of integrative medicine are now, opening up in medical colleges. They are going to open in all the AIIMS, and I see that in the coming decade, very exciting work is going to take place in this area, and we will be able to grow towards one nation, one health kind of a policy. Probably there can be, education also going in that direction, where we can do a integrated M.B.B.S, where person who does M.B.B.S, modern medicine forms the base, and he also learns, different systems of medicine, their strengths, weaknesses, and then at the postgraduate level, he can choose, which this is what is followed in China, where TCM is done at a PG level, whereas everybody does a fundamental medicine at UG level.
So they learn Western medicine first, along with few subjects of TCM, traditional Chinese medicine.
They understand that orientation to that, and what is the current evidence. So in that way, it can be called as an integrated M.B.B.S. So there will be only one UG degree. And at PG level, people can choose. For example, in NIMHANS, you can do integrative psychiatry. So you take psychiatry after M.B.B.S. Now you do integrative M.B.B.S. and go into integrative psychiatry. Similarly, you do integrative M.B.B.S. and then do integrative medicine. So it can be, the orthopedics becomes a integrative orthopedics, neurology becomes integrative neurology. So whatever is the modern mainstream knowledge is there, will be there, but we will enrich it with the knowledge that is indigenous to us, that is our own knowledge. Sushruta, is still called as the father of plastic surgery. So those people were doing, nasal flaps, much earlier. This is something that British learned from us. If you look at the equipments that Sushruta had, they are matching the current equipment that we have in surgery, in gynecology. So even in surgery, there are aspects that Ayurveda can enrich, especially wound healing, resistant wound healing. Honey, turmeric, they are miraculous even in resistant cases. So there are a lot of things that can be done if we just become little more open. If we really have that kind of a humbleness and compassion, that okay, I agree that I do not have all the answers and I really want to help my patient, then definitely doors will open and we will be able to grow towards this science.
It is very interesting to know that how far we have come till now and how far we have to go.
Yes, it is a long journey, and the journey of a million miles also begins with a single step. So we have taken a step forward, and we seek cooperation from people like you, viewers who are here, to take this science further. If they just believe that what I am saying has any sense in it.
Definitely, sir, definitely. During our course, we were given the book The Science and Art of Yoga in the Management of Psychiatric and Neurological Conditions. So it was a book published in NIMHANS and it has reached psychiatrists around the world. So in USA, people are reading it and they have found it to be very helpful in understanding integrative approach. So can you elaborate about the book?
Yeah, this is a compilation of our work that we have done in the last 15 years. The title of the book is Science and Art of Yoga in Mental and Neurological Healthcare. It is JP publication. The book is available in Amazon. Kindle version is also available. The book basically, gives you an overview of what is yoga therapy, what are the mechanisms through which it helps different mental health and neurological conditions. There are chapters on common mental and neurological disorders, and at the end we also provide evidence-based yoga modules. So this is a book which the modern medicine physicians can read and be benefited. Definitely a must for a yoga therapist, and also people who suffer from these kind of illnesses will also develop a better awareness of their problem, and the way the problem is looked at from the modern as well as the traditional viewpoint is also described in the book.
Yes. And doing the CCIM course and reading the book, I realized that many things should not be given to a patient. Like if a patient is having severe depression and he is already having ruminating thoughts, if we tell him to do meditation, it can actually worsen his condition. So that was really helpful because a lot of people prescribe meditation to depressed people. Similarly, in anxiety as well, if they sit still, their thoughts are going to increase. So, can you shed a light on how yoga therapy is given step by step?
Yeah, I think this is a very, very important question. Generally, we have this kind of understanding that anything traditional is completely safe. So it is not so. Anything that produces effects will also produce some side effects. So therefore we have to be very careful. That is where the role of specialists come in. What is to be done, what is not to be done is also equally important. We have seen cases, who have learnt yoga from YouTube, some Kundalini yoga practice from YouTube, and actually developed a mental illness when they were completely all right. So doing yoga wrongly can lead to problems. So bipolar episode got precipitated by Kundalini yoga, and those aspects are also there. So you should learn it from an authentic source, from an authentic guru who knows and understands things properly. Generally, our approach is that if a person has done a master's degree in yoga from a recognized institution, he will have this knowledge of what is not to be given. So we avoid meditative practices, we avoid advanced meditations in people who have schizophrenia, history of psychosis or risk factor for psychosis, people who have a tendency to go into depression, too slow practices in depression. Also in anxiety, we avoid fast yogic breathing practices like Bhastrika, Kapalabhati, because it can make them more anxious. Loud chanting can make them anxious or precipitate a panic attack. In epilepsy, you avoid that Trataka meditation where you look at a candle flame which is flickering kind of a light, or hyperventilation, fast breathing practices. Similarly, in people who have lumbar spondylosis, we avoid forward bending kind of asanas. People who have MI, history of MI, we avoid inverted poses because they increase the blood flow to the heart and cardiac workload. So in this way, there are several contraindications that you have to be very careful. In fact, this is the first thing which a yoga therapist should do. So first objective should be no harm. Whether you benefit or not is next. First, no harm. And after that comes the practice of integration. So in the same way, when we are practicing, Ayurvedic medicines, homeopathy medicines, we should be very careful that the medicines are taken from authentic sources. There is no toxicity related to metals, and so there are certain, authentic doctors who have been practicing and who procure medicine from authentic sources. From there only we should take, and not try to take these medicines over the counter just from the pharmacist, because many fake pharmaceutical companies, especially in Ayurveda, they make same medicines but they are just crap. So one should be very careful, and your Ayurveda physician should also tell you which pharmacy, if you want to take Ayurveda, which pharmacy is very important. One such authentic way we can trust is a Kottakkal Arya Vaidya, and similar other pharmacies are there, so we follow that. So these are important aspects in integrative medicine that we should.
It is really interesting that we consider ahimsa as the first step.
Yes.
So not doing any harm to others as well as not doing any harm to ourselves. Yes. That is very important, as you said, when it comes to practicing integrative medicine, because lots of misconceptions.
That should be the first and fundamental principle of integrative medicine.
Yes.
Yes.
How has yoga enriched your own life till now?
I can say yoga has been a savior. I was in a phase, there was a phase in my life when I was myself in depression, almost suicidal. So this wonderful age-old science came to my rescue, brought smile back onto my face, and seeing the effect on myself, the transforming effect of yoga on myself only propelled me towards this direction. What I have got, there are millions more who can be benefited by that. I see that every day of my life I am learning more and more, growing more and more. And this amazing science has given me everything, from the material aspects of life, to my profession, to the emotional enrichment, to the ability to be empathetic towards my patients, and the bond that I share with friends and loved ones. I give the whole credit to this wonderful science. In fact, I feel that I am nothing in myself. When I was depressed, that time itself I was just nothing. Now, whatever grandeur that is there in my life is just because I surrendered to this age old science, which is my life.
That is a very interesting story, sir. And it also shows that when we say modern medicine, it doesn't necessarily mean we take them ourselves. But when it comes to teaching yoga or doing yoga therapy, it is very essential that first we try it on our own, and then we once we see the effects, then we go and treat others.
Yes, yes. I completely agree with you.
So thank you, sir. Thanks a lot. It was a pleasure to have you on this podcast. And Hemant sir has his own channel on YouTube where he teaches Patanjali Yoga Sutras. He talks about yoga therapy. He talks about Ayurveda and different interesting topics, as well as some evidence-based practices for different conditions. So that link will be in the description. You can go and check out his channel. Especially, I would recommend his lectures on Patanjali Yoga Sutra, which are which are conducted here in NIMHANS as well as online. And we would again like to have you some other day, sir, and discuss each topic that we discussed in more detail. So thank you, sir. Thanks a lot.
It was indeed a great pleasure interacting with you, Shreyas, and I am really lucky to have a wonderful student like you.
Yes. And I am lucky to have a teacher like you, sir.